to the COVID-19 situation, updating on my statements after the National Cabinet meeting on Friday. Over the weekend and today, the Emergency Response Centre has been stood up in relation to aged care that brings together all the key agencies involved in supporting the aged care sector at a state and at a federal level, and that's being headed up by the National Chief Nurse, Ms McMillan, and we thank them for the work they've been doing, particularly over the weekend. The situation in Victoria, of course, the Premier will be updating Victorians and the country more broadly on those matters in his regular press conference. But just to suffice to say that the federal government continues to provide every support, the increasing deployment of ADF personnel across a broad range of tasks, including, as foreshadowed, the door-to-door operations, right through to tracing supports, logistics command support, support and testing centres, and that will continue. It's important to understand that the challenges, and they are significant in the aged care sector, are a reminder that when community transmission occurs with COVID-19, the aged care sector will always be impacted. That is certainly the experience we've seen in other countries. When you have problems in aged care, it is a function of the community transmission. Now, this is an important point to note because it behoves all of us. If we want to protect the most vulnerable in our community, that's why it's so important that those of us who may be in a less vulnerable position are continuing to follow the advice, performing the safe distancing and other practices about getting tested, about remaining isolated when you're a close contact. All of this is incredibly important because when community transmission takes place, it is inevitable that it will find its way into the more vulnerable parts of our community, and the aged care community is certainly one of those. Now, one of the key things that are being done in the aged care sector currently is transferring people who have contracted COVID into hospital facilities, and we're making use of the private hospitals agreement that we put in place some months ago to free up beds in the private hospital area so we can transfer people out of those facilities into those beds, and we're working closely with the Victorian state government about that process. I was in contact earlier today with the Premier on those issues. The other part of it is ensuring that the infection control management in aged care facilities is being closely monitored. We have already put some 1.5 million masks into aged care facilities, and about that number and a bit more are also further going into aged care facilities. That's part of a broader provision of personal protective equipment that has been deployed in Victoria. I should stress that the Commonwealth is not the only level of government that provides PPE material into the health system. Of course, the state governments also do that, and in fact are the primary providers of that equipment into healthcare facilities in their jurisdiction, but the national stockpile is being drawn upon to support their efforts to ensure that's in place. It is vital that in those aged care facilities those infection control procedures are being followed. The Commonwealth put in place training for infection control in relation to COVID-19 in recent months, and it's a matter now of ensuring that those infection control procedures are being adhered to strictly in those facilities. Because obviously in aged care facilities you're dealing with the most vulnerable members of our community, and that is where you see the most awful of the consequences of the COVID-19 pandemic. That is where the loss of life in particular occurs, far more significantly than any other part of the community. Although it is true to say that others who are younger can be susceptible, and it can prove fatal in some circumstances, as we have already seen. So all effort is being deployed to ensure that we're doing what is necessary in the aged care sector. We're also working closely with families. I'd note that the Federal Aged Care Minister, Richard Colbeck, last night was on a Zoom call with one of the facilities and family members from those facilities. There is a single person which is identified for each family who is the contact person, and I'm advised that they're being kept up to date on a daily basis, that single family contact member. Obviously you then rely on that family member to update other members of the family, and that's what's put in place across not just there but all parts of the country, is my advice. So we will continue today to focus our efforts, particularly as we have been now for some time, on providing whatever support is necessary in the aged care sector.